Welcome back to the Patient First podcast. Today, we're discussing a big topic, continuing education. Now, I think that we are unknowingly sent in a singular direction when it comes to continuing education, and that we've been falsely led that there's really one area of our entire career that we need to focus on in continuing education, and that is our clinical care. In other words, when we come out of dental school, we're focused on the necessary aspects to produce dentistry, which is vitally important, but it makes us completely ill equipped for some specific areas that we'll go through today. Not just ill equipped, but pretty much, in my case, completely ignorant and deficient in knowledge in some areas that are crucial to our careers and providing the dental care to our patients that they need. Let me illustrate this with you with some cold, hard facts by way of our friends at Google. If you Google leadership course for dentists, okay, leadership course for dentists, at the time of this recording, you get 2.38 million results, just under 2.5 million results. And that sounds like a lot. So there must be a lot of people out there searching for leadership course for dentists, correct? Well, if you Google dental bonding agent course versus leadership course for dentists, you get 15.5 million results. That is 6.5 times more results looking for dental bonding agents than for a leadership course for dentists. So let me ask you a simple question. If you've been listening to the podcast for a while, you may have some insight into where I'm going to go with this, but how much do we really need to know about dental bonding agents, right? That we didn't learn in dental school. So we've got entire textbooks on dental bonding from dental school. Keep in mind, I graduated 22 years ago, and bonding hasn't really changed in those 22 years. Granted, neither has leadership that much, a little bit. People that we're leading are more different than bonding agents. But let's be honest, right? Chemists are the ones that need to know this. And a little unveiling of the wizard behind the curtain, every bonding agent works, right? Every single bonding agent that I'm aware of, and I've tested lots of them, every single one works if you use it the way it was intended. There's chemists who I've met, many of these brilliant people who come up with these bonding agents, and they work their entire lives to increase the bond strength to make these bonds more predictable. And when I got out of dental school 22 years ago, I got news for you. Bonding agents were very predictable, and they are even more predictable today. And, even though there's 6.5 more time search results on dental bonding agents than leadership course for dentists, they still have to distill these instructions down to pictograms with as little words as possible, 1, 2, 3 format, so we can't screw it up. Why? Well, we're never going to learn nearly as much as we need to know about dental bonding. We're not going to know all the chemistry, and nor should we. It's not really our job. It's the chemist's job. We have to rely on them to do that. And then what's our role? To follow some instructions. Pretty much that's it. Use the products the way they're intended. As I've said before, every single bonding agent works. Just read the instructions and use it the way that it's intended. We don't even need to take a course on dental bonding outside of dental school. We have to have the basic fundamentals, obviously. But in my world, in 22 years, that really hasn't fundamentally changed at all. Bonding agent composites are pretty much the same as they have been. Obviously, there's been some advancements, but those are slight variations on a theme that you can easily talk to the chemist or even a sales rep to understand. So, how do we actually use this information? Right. So before you go up and sign for that dental bonding agent course, right? Obviously, think, do you really need to take that? But more broadly, how do we use this information? I would propose that before you sign up for any clinical course, now I'm not at all wanting to disparage the value in learning about clinical dentistry. We have to know how to produce excellent quality care and be leveling up our clinical skills at all times. But before you take a clinical course that is super interesting to you because you have no idea what it's about, ask yourself this simple question. Are you really going to do it? Are you really going to perform full mouth composite veneers? because I took multiple courses on full mouth composite veneers, and I've done a couple, and I realized very quickly I hate doing them. They're less profitable, and the results are worse than porcelain veneers. So I quickly decided I'm not doing that anymore. I spent a lot of time and energy going down that path to realize it was wasted time and energy. And this is the time I'm taking away from my family outside of my practice to go learn something new, right? Do you really need to retake a course on sleep apnea if you've already taken two and you refer all sleep apnea courses anyway? Another thing that I did, we had somebody in my practice that treats sleep apnea. So we could just refer to her. Why do I need to learn about it other than the diagnostics to refer people to her? Right. And again, I'm not at all trying to say that there's not value in learning about clinical procedures and relearning information or expanding what you know. Just make sure to prioritize your learning. For example, if you took a course on implants and you place implants today and you want to go to the next level and maybe do more guided or maybe more unguided, or maybe you want to learn how to do a specific procedure using implants that you know you're going to expand what you do, absolutely, absolutely. But that's very different than learning about a bonding agent or learning about sleep apnea when you're not actually going to, you have no intent actually in bringing it into your practice. So I would propose that you look at leadership as a void in the universe right now, let alone very much so in dentistry. As part of the Insanely Productive Dentist workshop that we do here at Upgrade Dental, or we like to call it IPD, I talk to dentists every single week about their problems in growing their practice. And what I'm really seeing is that there's a lack of leadership training in dentistry. And we focus heavily on what leadership is and why you, as a dentist, and anybody basically in a dental practice, I believe, is in a leadership position. So you don't need to be running the practice. You don't even be needing to touch the financials. We work as a team and we're leading patients. So everybody in a dental practice has some aspect to their role that is leadership, empowering people, inspiring people, leading change, sharing a vision. This is all very important and core to what we do, that I would argue it's something that has to be prioritized that isn't in a lot of practices. And since we've come out with IPD in February of this year, it's been phenomenal because we do focus a lot on leadership. It's a big aspect of what we do at IPD. And that's led to us being completely sold out. And that made me really reflect because so IPD recently sold out. As part of the onboarding experience of every IPD member or insanely productive dentist member, I do an onboarding call with people just to get to know what they're looking for, and then I do a monthly Q&A with all of our IPD members where I answer people's questions. And so I kind of reflected after we sold out because we didn't have capacity anymore. That why is that? And it's, I believe, based on the data that we have and going through it with my team, that it is strongly because of this. There isn't a great leadership course for dentistry outside of IPD. And so it's really opened my eyes. And so, like I said, it's sold out right now, but we are having new cohorts. So if you want to get in line to join the Insanely Productive Dentist Workshop Series and really level up your leadership in a great way where we have workshops and sessions and Q&As every month. It's a 4-month series. Just go to upgradedental.com and click on Insanely Productive Dentist or IPD, and there'll be a spot for you to put in your information, and we'll let you know when the next round of the workshop is open. And I look forward to seeing you there. Thank you very much. And of course, as always, I look forward to seeing you next week here at the Patient First Podcast. Make sure to like, comment, subscribe. Let me know. Do you have other priorities that you have that you'd love to focus on with your continuing education? Or if you think that leadership isn't an issue in dentistry, or if you have ideas for people to implement about leadership, I'd love to read your comments. So please like, comment, and subscribe, and come back next week. We'll see you here on the Patient First Podcast.